So thanks very much, everyone, for joining the question and answer session about the Research Training Award. So this is one of the first new awards that we are launching, and it is a award that is really intended to help people to progress along a pathway to some of the other new personal award schemes that are coming out. It's only open for people who are employed either in the NHS or in social care. And as you can see, there are a range of other awards, but it would be easy for people who were successful in the Research Training Award. You could see how there would be options to move either on towards submitting an application for a PhD level doctoral fellowship, or else to submit an application for a smaller piece of research that might then allow you to submit for other types of grant funding through, for example, NIHR or MRC or some of the charity funders. So next slide, please. So this scheme provides you with funding for tuition fees, which will allow you to undertake a master's in research degree or an equivalent M-level research training degree. Now, what is important to recognize is that different institutions call these degrees different things. Some of them will call them an MSc in Research in Health and Social Care. Others might call them an M.Clin.Res or a Masters in Research. So the name of the degree is less important than the content of the degree. So the award will provide tuition fees, and you can also request salary costs for up to a day a week. We are looking for accredited degrees. They need to be either focused on health or social care. And what's really important is that when you apply for this award, that you make a case for how this award will help to develop your specific research area and will help you to move along either a research-focused clinical career or a research-focused practice career that's for social care. But you can take a course on a full or part-time basis, but there is only salary costs for 1 day a week. And the award is open to all health and social care professional disciplines at any career stage, as long as you are working in the NHS or social care. So as I've said, you need to be in employment in the NHS in Wales or local authorities. You can also be working in the independent health and social care sector in Wales. So, for example, people who are working in community pharmacy or in other settings. And you need to be able to commence your chosen course by January 2024 at the latest. So there are some courses which have September, October intake and a second intake in January. But you would need to contact the course leaders to establish the start dates. There is an expectation that you remain in employment in the NHS in Wales or the local authority for the duration of your award. And you must have the support of your head of department or equivalent in your employer's organisation. And then you have the responsibility to make sure that you meet the eligibility requirements for the chosen course. Next slide, please. So your courses need to include at least 80 or 90 credits dedicated to taught health and care research methods at M level. Some courses have a research placement option, but we are looking for at least a 60-credit dissertation. Some of these, and preferably where you are using that to develop a research proposal. And the reason for that is that we are looking to see people being able to move to the next step in their research career. So we're wanting you to have a lot of support around developing a competitive research proposal that could take you forward to submitting an application for PhD funding. So I've just pulled out a few example courses, because if you've read the guidance document, you'll see that we don't specify which course you need to apply for, but I've pulled out some examples which do meet the criteria. So on the left-hand side of the slide, you'll see a course where there's core modules. There is sort of a core module in one of these courses is epidemiology, statistics, and then practical epidemiology, and then a 60-credit dissertation, along with a range of optional modules: healthcare evaluation, health economics, qualitative methods, principles of health technology assessment, economic evaluation, health information, mixed methods research design. So you can choose a course that allows you to fit with your research interests. On the right-hand side, here's another example of a course at a different institution where, for example, the optional modules are implementation science, or leading change in health services, or qualitative methods and process evaluations. So next slide, please. Social research methods. So here's an example of another course where you've got ethics and philosophy, quantitative methods, data collection methods, and qualitative research methods. So you can see how that would build up to at least 80 credits of taught research methods. Next slide. Clinical trials courses are also available, and you can see some example courses where there's rationale for clinical trials, delivery and management of clinical trials, analysis, early phase clinical trials, design and delivery of clinical trials. Or another example would be where you've got 4 compulsory modules, and then you choose a further set of elective modules. And then you can also choose courses which focus on public health or health services or health economics, again, where you could choose, for example, optional modules around health improvement, health economics, economic evaluation, qualitative methodologies, and statistical methods in epidemiology, for example. Okay. So next slide, please. So the panel will be looking to see how this course will develop you towards your PhD studies and your future clinical research practice or practice academic research career. We're looking to see that you justify your course and how that will relate to your research interests and how that will progress your research intentions. So it's important to show in your application how your research career beyond the term of this award will be influenced by this award. And again, making sure that there is support from the relevant employing organisation. So, for example, whilst Health and Care Research Wales will provide funding for 1 day a week, if your organisation were to say they will give you additional study leave because they're really keen on seeing your research development, then that would be something that the panel would be viewing favourably. Okay, next slide, please. So in terms of the support, so those people who are successful in being awarded one of these research training awards, in addition to the support from the institution where you register, is that you will then have access to the faculty, the Health and Care Research Wales faculty mentorship scheme. We will be establishing a peer support group for all research training award holders so that you learn from other award holders who might be doing their training award in different institutions. You will also have access to the faculty learning and development programs. So, for example, there's a leadership program. We're planning project and budget management courses. You'll get information about the faculty webinar series, be able to attend the in-person development days, and also have access to the faculty researcher development advisors. So that's about trying to make sure that you take this award and you do continue to develop as a researcher. And I think the next slide, I think this might be the last slide. So application deadline, 4 p.m. on Thursday, the 13th of April. The funding panel meeting is in May, and final decisions will be announced in June. This will allow you to complete your applications for your courses, or to make sure you can submit by July 2023. So that's the deadlines for the funding.